host, Chef AJ, and this is where I introduce you to amazing people just like you who are doing great things in the world. This guest I actually met at the Sacramento Veg Fest where I was a speaker, and this was 6 years ago. And I cannot believe it's taken me this long to interview him because he is fabulous. His name is Dr. Rajiv Misquitta, and he has quite a story of his journey on a plant-based diet and why it started. And you really want to listen to this one because just realize that nutrition is very, very powerful. And he's going to be talking about the power of plant-based nutrition. Please welcome to the show, Dr. Rajiv Misquitta. Thank you so much for being here. I'm so excited to talk to you.
Great. Thank you so much, Chef AJ. It's always a pleasure to talk to you. Yep. You're very inspiring. And just a little bit about myself. That background, by the way, you're seeing in the back, it's a virtual background. So hopefully it comes out okay. So my name is Rajiv Misquitta. I'm an internist, and I'm also certified, board certified in lifestyle medicine, which is a new field that's focused on improving health with lifestyle measures such as diet, exercise, and stress reduction, among other things. I'm going to actually begin with a slide deck. So if you bear with me, I'm just going to pull up a deck for everyone.
We love so much that you do a presentation. Thank you very much.
Great. I think that's on there. So I'm really delighted to be here to speak to all of you. Thank you so much. I appreciate you taking the time. And I'm going to start by taking you back, way back, about 11 years ago. And I'm just going to try to move this. Okay, there we go. I just want to make a disclaimer first that the views and interpretation on this deck and what I'm going to speak about are my own views and do not represent any particular organization. So let me take you back about 11 years. This was around 2009. It was the fall, and I had a very vibrant practice. Things were going really well for me. And my boys were 1 and 3 years old at the time. And I live in California in the Sacramento area, and some of the trees actually start changing color around that time. I recall I was driving to work. I had just dropped off my boys at their preschool, and as I was driving to work, I noticed some indigestion, and I was wondering if it was that greasy food I ate the night before, and I tried to not think about it, and then I got to a stoplight, and it started to get worse. And then before I knew it, I started to feel some chest pain and some shortness of breath. And at that point in time, I realized what was going on. I had actually just turned 40, and my father had had a heart attack in his late 40s, and I sort of realized at that point. And now I was about 10 minutes away from work. I probably should have pulled over to the side, but I stepped on the gas and I drove straight through to my hospital and parked in the parking lot and steeled myself for a few seconds and then stumbled into the ER. Was lucky to make it in there and tapped my colleague on the shoulder and said, I think I'm having a heart attack. To his credit, they got me on a gurney very quickly, which is a little bed, and the nurses ripped open my shirt. They put the EKG leads, and when they had it done, I asked them to show it to me, and this is the actual copy of it. I was horrified. It was pretty clear that I was having a heart attack, and you can see it by this abnormal graphs on V2 and V3. And so the nurses and the doctors rushed through everything. They got me on all the right medicines. And then I was quickly transported to this, which is called a cardiac cath lab. Some of you might be familiar with that. And I was placed on that, and the cardiologist used a catheter to cannulate my vessels. And after the cardiac cath was done, he came over to me and said, well, I have some bad news and some good news for you. The bad news is that you have some major disease in one of the main arteries, and the good news is we were able to put 2 stents in there. And that was a shock for me. Not too long before that, I was snowboarding and really very active with my kids and family. And so I was rushed up into the hospital after the stents were put in, and they put something called a sandbag, which is a heavy object on your groin. It almost feels like someone's sitting on your groin. contain the bleeding, and stayed in the hospital for a couple of days and then went home. And when I got home, I was determined to try to prevent this from happening again. I couldn't understand it. And so I made some changes. And at that time, the American Heart Association had recommended less than 30% of calories from fat, a little bit of fish, some fiber-rich whole grains, and then reducing processed meats. So I changed my diet to reflect that, and started working out at the gym pretty regularly, and picked myself up, and things were going okay until a few months later, while I was at the treadmill at the gym. As I turned it up to 4 and 5, I started getting some chest pressure. When I brought it down to 3, it went away. Turned it back up to 4.5 and 5, came back, turned it down, went away. So I knew this was not good. And so I went in, talked to my doctor, and went ahead and did what's called a treadmill. Some of you may have done that, which is very similar, getting on a treadmill and with some EKG leads on you. And when the treadmill was done and the results came back, they were positive. So this essentially meant that I had some recurrence of disease. I was quite unhappy at that time. And so I went home. It was the weekend. And that Saturday, I woke up in the morning. As I was having breakfast, I started noticing some chest pressure at breakfast. And that's called unstable angina. It's when you have symptoms just at rest. And so we quickly called the ambulance. And I didn't want to alarm my boys, who were actually very young, and kids love fire trucks, and fortunately they weren't afraid, and the firemen came and they got me in there, and I was once again rushed back to a cath lab, and the cardiologist, who I trust very much, went ahead and did the procedure. And after it was done, he told me that, well, I have some bad news and good news for you. The bad news is that those stents have blocked. There's some blockage forming, and you have other areas of blockage, and you're going to need bypass surgery. And the good news is we have a great surgeon right over here who is happy to do it. And so I was in shock. And so the person came and shook my hand, and I was rushed up to a room, and it was the weekend. I was placed there waiting for surgery the next day. And so the day before surgery, the nurses were very kind to me. They were shaving me for the bypass surgery on the chest and legs, and I felt like a sacrificial lamb. It was about the first time I switched from being a doctor to becoming a patient, and that was just a tremendous transformation. The next day, I was given something to calm me down, and then rolled out to the operating room, and that's actually what it looks like. For a cardiac surgery, there's a narrow table where you're laid out on the table. Your arms are splayed out on either side. It's almost like a cross. They're bound down. And as they get ready to open the chest, and the anesthesiologist leaned over me, and then after that, the lights went out. And when I next awoke, I woke with a tube coming out of my mouth. It was a ventilator, and there was a chest tube, a tube coming out of my chest. They were able to extubate me, take me off the ventilator, and I begged them to take out the chest tube, but fortunately they said, no, we're going to wait a little bit. And they moved me to a recovery area. And that's when my whole process of recovery began. And this was about 11 years ago. I recall having to hold a pillow to my chest because of the surgery. They actually saw the ribs and they wired them back together. So walking was quite painful. And then I had to actually use a walker initially to move. And I had been snowboarding and exercising not too long before that. So I was quite unhappy about it. And so I quickly moved towards recovery, and was determined to make sure this never happened again. And so I started looking into things a little more closely. And I'm going to share some of those learnings with you, and maybe it'll benefit some of you. So when it comes to heart disease, it's the #1 cause of death in the US, and actually it occurs worldwide as well. It's a pretty high cause of death everywhere. In fact, someone has a heart attack every 34 seconds when you look at it. In the US, and every 60 seconds, someone dies from an event related to heart disease. You may not think about it. People think that breast cancer is the #1 killer of women, but it's actually heart disease. It's something that we all need to be aware of. So for me, it was sort of a fork in the road, so to speak. That's actually a fork I stuck in the road. It's because it was a change in my life, and it was a transition as I started looking at things and changing my perspective on things. And so the first thing I came across was a study by Dean Ornish. And this is a study that had been done in the 1980s, and many of you have probably already heard of it. And so he used a combination of diet, exercise, he used some yoga, and stress reduction on patients who had heart disease. He took approximately 40 or so patients, half of them the traditional treatment for heart disease. And these are patients with proven heart disease. Half of them got what was recommended by modern medicine. The other half, he put through this regimen of diet, exercise, stress reduction. And the diet was essentially a plant-based diet. It was a plant-based diet with the exception of allowing skim milk and egg white. And so what he found was that in 1 year and 5 years, there was actually an improvement. The arteries that were narrow had gotten a little bit bigger. So they had opened up a little more. The cardiac arteries that actually opened up a little more. And there were less cardiac events on the patients who did the diet and exercise pathway on the trial. And there were improvements at 1 year, and there were even more at 5 years. And I felt encouraged by that because, with modern medicine, I knew that if you have a heart attack and you have bypass surgery, you're coming back for more events later on because we can slow things down in medicine, but we can't reverse cardiac disease. We slow it down with medicines and procedures. But here was the first time that someone actually showed reversal. So I felt quite encouraged by that. And then I also stumbled into Dr. Esselstyn's work. And Dr. Ornish had done a randomized control trial, which is considered a very good trial. And Dr. Esselstyn also did a great trial, but it was more of a cohort study where he followed patients who had heart disease. And it was slightly different. And he followed them. He took patients who had severe heart disease. He put them on essentially a plant-based diet, very similar to Dr. Ornish's diet. And then he followed them at 5 years and then later at 12 years. And his goal was to keep their total cholesterol below 150. And he did that essentially with the diet. And he permitted medications. He permitted that they continue their cholesterol medications. And as you can see, their cholesterol, he was able to manage and keep them below 150. And what he found in the patients that adhered, who stuck with the diet, they had no further events. And it was a small group, around 20 or so, and then less than that when you look at adherence. But they had no further events. And some of them had cardiac CATs done, and it showed arrest of the disease, which again, to me was remarkable. To me, it meant there was hope. There's a way to actually reduce this disease, maybe reverse it and hope for a long life. And so when you look at the physiology of this, I actually drew this out. Hopefully the sketch looks okay. What actually happens when you eat fatty foods, there's something called LDL cholesterol, and there's that yellow stuff you see on there. And that causes the fatty foods cause damage to the endothelium, which is the inner layer of the artery, almost like a carpet. And once that gets damaged, it gets into the blood vessel, into the cells, and there's something called monocytes, which are cleaner cells that come in. They start oxidizing this cholesterol and cause what's called foam cells, which are cells that are very inflammatory. And these cells further destroy the layer of the blood vessel and cause a thrombus, which is that red thing that you see, and that is the clot that shoots out and blocks the arteries. And so the insult is from the food. The fatty foods, among other things. And we know this inflammatory nature. And then I also learned more that this is not just good enough for heart disease, it's also good for diabetes. And, diabetes is a huge issue in the US. As a physician, heart disease and diabetes are large contributors to chronic illness. And so what can we do for them? And there was a study done by Neil Barnard, which also had an impact on me. And he took about 100 people with type 2 diabetes, and he put them on a plant-based, essentially a vegan diet, low in fat. Half of them were on that diet, the other half on American Diabetic Association diet. And then he followed them out. And then what he found was that their blood sugar control improved. The folks on the vegan diet had better control of their blood sugars. Some of them are able to come down from their medications as well. So although it's high in carbs, it actually improved their diabetes. And so that was an interesting finding, because normally people are steered towards low carb foods. And what he also found was it was more than just being plant-based. He measured something called the thermic effect of food. When you actually eat food, you burn energy. It takes energy to eat food. And it can be measured with a heat blanket, and you can measure how many calories you burn just eating the food. And it would be advantageous to you to burn more calories eating food, because those are free calorie burns. And it seemed that eating plant-based foods had a higher thermic burn. So you actually just burned some energy just eating those foods. It's probably digesting fiber and everything else, which is great. So there's less chance of obesity when you think about that. That's just part of that. And then also, the other problem with diabetes is the fat. As we gain weight, there's fat that develops in our muscles, and it's called intramuscular fat. And this is just a picture I took at a grocery store of, I think it's some steak. And you can see some fat, maybe in some of it, some whitish streaks of fat. And that gives probably flavor to the food, but that's how fat develops within the muscles. And it can happen in humans as well. And when that starts happening, it affects the way our bodies signal, the signaling that goes on to handle glucose and insulin. And once the signaling gets disrupted, then that can lead to diabetes. And type 2 diabetes is not an issue of having less insulin, but you're producing more insulin, but your body is not able to take it in. The receptors are not taking it in as efficiently as they could. And just the reduction in this fat within the muscle improves the effectiveness of insulin and helps reduce diabetes. And plant-based nutrition seems to help with the reduction of fat as well as that. So to me, it seemed that, boy, there's so many obstacles as we look at trying to improve our health. It's when you look at trying to get healthy food just outside, the messages that you see as well. And so this is how I felt. And that's a picture actually of me at Yosemite. I was just leaning on a rock and I had my son take that photo. And it may feel to many, boy, there's so much information out there. What do I do? There's very confusing. There's so many mixed messages. But, there's a lot of data out there in plant-based nutrition, more so now than in the past. And we know when I type in plant-based nutrition into PubMed, which is a repository of medical information, it's thousands, literally thousands of entries come out, and there's something that's being published almost every week. We know that plant-based diets are associated with a lower body mass index, a lower rate of obesity, and there are many trials that actually show that. In fact, there was one trial I came across, and this was in the Nutrition Journal in 2015, which compared several different diets. Looked at the vegan diet, vegetarian, pesco-vegetarian, semi-vegetarian, and omnivorous group, and looked at the percentage of weight loss in 6 months. So if you're looking for the most efficient eating plan, you can see the highest reduction was in a vegan diet, a plant-based diet. So not a surprise. When you actually start losing 5% of your body weight, you start reversing some chronic illness. So that's a good number to try to meet. But clearly, eating plant-based does push you in that area. And part of that could be vegetarians eat more food while eating less fat and calories, and makes sense because there's a lot of fiber in there. You're eating a lot of food, the calories are less, you get full faster, and so we're not just eating. And but vegetarian food is not necessarily healthy, right? You could eat vegetarian food and be very unhealthy. And probably you have friends that say, look, I know someone who's vegan and vegetarian and they're extremely unhealthy. They have cancer and heart disease. Because you could eat unhealthy vegetarian and vegan food. And that's why I like the definition of plant-based, because when we talk about plant-based, we're talking about more whole foods, not refined grains and sugars, but more whole foods and whole grains. And then, of course, avoiding high fat and meat foods and meat and fried foods. And this French fries, someone may consider a vegetable, but with the high content of fat in that, it's not as safe. And when most people think about protein, what I found is that in my experience, they think about beef. They say, I need to get more protein. And I have a teenage son, and he start working out and says, oh, I need to get more protein. I think I need to eat some more meat. And there's a lot of misinformation out there in terms of protein. We know we can get that in beans. There's plenty of protein in beans and tofu, and there's just lots of options. So, I want to take a minute to talk about my dad, because there is some pertinence here. That's my dad and my mom, and we were visiting Tahoe that year. And so he has actually influenced me in many ways. And to me, I'd like to remember this of him. I'm going to take you back to the 1980s. I had just moved here. We had just immigrated out here, and I was living in New York. And I was a teenager, around 14 or 15, and my dad would just turn 49. And he was at work, and when he experienced some chest pain and some shortness of breath, unfortunately, his coworker recognized it for what it was, called 911, and he was rushed to the hospital. And when they did the cath at that time, they found that he had some severe coronary artery disease. Didn't have a lot back then. They had him in the ICU for a while, put him on some medications, maybe some angioplasty at the time, sent him home, and then said he would need bypass surgery. And so he had bypass surgery at that time, recovered from the surgery, and then things improved. But only a few years later, started developing those symptoms again. And then he had some stents put in, and then the symptoms returned until to the point that he couldn't do much because of his cardiac limitations. His heart condition continued to worsen. And around that time, I had finished my residency at UC Davis, and I had started my practice. And so he had heard about the Ornish diet at that time. His doctor had mentioned it, but it was not really pushed in a big way. And so he tried some of that, but not fully. He was still eating other things because the American Heart Association had recommended, fish and all of the others. And so as the years went by, his condition got worse and worse. He would get some angina or chest pain just walking to the mailbox. And so around that time, I had my event, and so I recall that there was one point in time he was living in Las Vegas at the time. They tried to do a stent on him, and when you do a stent in an area that already has disease, they dislodged it, and it caused another heart attack. And so I'd gone to visit him, and I said, okay, let's stop. I brought him over to UC Davis, and they were able to put a stent within a stent, and then things got better. And he went home, and then within a year, symptoms came back. Brought him back to the cath lab there. They put a stent within a stent. Things improved. Went back home. Within a year, symptoms came back. Brought him back to the cath lab. Disease recurred. Stent within a stent within a stent. So this is 3 times. So I said, how long can this go on for? And they said 7 times. And I said, okay, we need to stop the cycle. And about that time, I had actually had my event. And so I switched my diet completely to the Ornish diet. And I talked to him and my mom, and they were really open to that. And so she cooked Indian food, which she enjoyed, with plant-based and no oil, those recommendations. And it was amazing. He started changing. His life completely changed. And within several months, he was, walking longer. He was in the gym for 2-3 hours. And then my mom called me and said, you got to do something. He's pretty active. I said, oh, well, that's good. So things had improved. He had outlived 2 of his cardiologists who died of heart attacks. And so he often wondered, why couldn't this be offered to patients in the beginning? And so to me, that was the motivation. I think it's important to provide this option. And so, and at some point he developed a little bit of, he thought he had some symptoms while exercising the treadmill. So we took him back to the cath lab, and the results actually look better. So so it was good news. And so I'm always grateful to him for having shown me. It sort of also opened my eyes, because, you may hear of some things, but when you see it, you personally, it makes a huge difference. So it kind of changed my perspective, almost like this glass ball as you're looking out at the view there. It changed my whole perspective on chronic illness. How should one approach chronic illness? And so, I just want to pivot a little bit to our current time, because we're in an interesting time now with COVID-19 and the virus out there. Hand washing and masking, so important. But there's something else we can do. When we look at some of the data behind COVID-19, it seems to really be very active in fat cells. So those who are obese, it actually have worse outcomes. And there was a study done in Germany that I just read a few weeks ago that when they looked at folks, they measured the fat cells in the abdomen, they called them visceral fat, and found that those who had a higher amount of that had slightly worse outcomes and worse times on the ventilator. And so clearly this virus doesn't respond well. And we know that because the CDC has also put that out in terms of risk factors. So I think, with lifestyle, using nutrition and then even exercise, you can reduce some of those risk factors. So you can actually do something to stay ahead, although vaccine is still far away, by following certain guidelines with nutrition and exercise and reducing that visceral fat. You could actually improve your chances of doing well. So I just wanted to toss that out, that there is something we can do. And we know that plant-based nutrition is pretty effective in losing weight. And also the other things I stumbled into, which are some of the byproducts of plant-based nutrition, it requires less resources. And here's some statistic I ran into where it takes 3,000 gallons to feed enough cow to make a quarter pound of hamburger. And so even with water, conservation of water, which is very important to us in California, this could be very helpful. It also requires less energy to produce than other animal-based diets. And over here we can see that it uses much less fossil fuel. So that's a good thing overall. And then, once again, water conservation. I know we're trying to water our lawns less often, but, switching to a plant-based diet even once a week can help us conserve water. Also, in terms of resources, animal-based diets require roughly quite a bit of land to produce them. And if you look at this, it's much more than we have. And so 14 times more land to produce than plant-based diets, which is interesting when we think about that. I love this quote from Michael Pollan. He's one of my favorite writers, where he writes, "Eat food, not too much, mostly plants. That more or less is a short answer to the supposedly incredibly complicated and confusing question of what we humans should eat in order to be maximally healthy." That was actually published in New York Times Magazine in 2007. But I think it really is very profound. And, this is a picture from a medical museum at my medical society. It's where I get a chance to look at some of the herbs and tonics that were put out a century ago, and I think about, how medicine has evolved. Here's a quote from Sir William Osler, and some of you may have heard of him. He is considered one of the most eminent physicians of all time, and he initially worked at Johns Hopkins and has written a lot and done a lot for medicine. And this was several hundred years ago. And he said, "The young physician starts life with 20 drugs for each disease, and the old physician ends life with one drug for 20 disease." And I think that it may not be a drug, but that one thing is lifestyle. And nutrition is certainly part of that, because what we're looking at is not just one piece of it, trying to affect all of it. And to me, it's almost like the elephant. I don't know if you've heard the tale of the 7 blind men from Hindustan, where they one of them feels the tail and said, "Oh my gosh, this is a rope." Another feels the trunk and feels it's a pipe, and someone feels the leg and feels it's a wall. But you're not seeing the big elephant as a whole. And that's what we need to be looking at. We need to be looking at disease from a holistic perspective. You want to stop the disease from where it starts. And certainly I think medicines are very important. We need to use them, but we also need to look back to see how we can stop the disease as its source. And that's where nutrition is a huge part of that. I mean, exercise is also part of it, but nutrition is a huge part of that. I mean, where do I start? Many of you are probably already doing this, but if not, shrink the change. Maybe one plant-based meal a week, and then learning how food is prepared. And Chef AJ is the expert here. I think unless you roll up your sleeves and get involved in it, it's really hard to really be invested in that. So that's really important. And then knowing your resources are important as well. And here are just pictures of some of the information I like to share with folks. Definitely grains are an important part of it. Whole grains, brown rice, barley, those are all important. And then incorporating a rainbow of fruits and vegetables. And that was a meal I purchased at a restaurant, because now more restaurants are actually making, this was before COVID, more restaurants are making plant-based meals. And really, it was delicious and also looked good and had the full rainbow right there. This is a picture of my spice cabinet. I think it's important to use whatever you can, all the tools to get flavor, because flavor is important to me. I don't eat bland food, and some people think, oh, you plant-based, you're eating plastic or rubber, but that's not true. To me, food has to be tasty, it has to be delicious, and you have to enjoy it. And so use every tool that you can. And then don't be afraid to try something new, whether it's tofu, tempeh, or seitan. There are so many things out there, and it's exciting to learn more about this. And then using substitutions for dairy, like almond milk or soy milk. These are all other options. They're freely available now. Here's an example of breakfast, which is just oatmeal and berries, banana. That's one of the many things, but there are many options. Or here's the scrambled tofu. Very easy to do, and that's made with tofu. And this particular one has an Indian flavor with some curry powder and some spinach on it, and delicious. It's really, really a great way to start the day. And then some quick snacks. Hummus is always good. That's a hummus made from garbanzo beans. A lot of fiber in there, and you can do a vegetable dip or put on bread. Low in calories, high in fiber, really good for you. And then just wanted to touch on the behavior change. Behavior change is a hard thing to do. And I realized, food is important, but it's not really about food. It's about behavior change. How do we change our behavior? And that has consumed me in my research over the last couple of years as I research this further. This is a talk. It was a program put out by a city not too far from where I live, where they brought in plant-based speakers and speakers on lifestyle and exercise for several weeks. And it was a program they wanted to improve the health of their citizens. And so I attended it. I spoke at one of their functions, and it was a weekly function. And then the person who organized it sent me the survey of surveying the folks who attended. And I think you'd be interested to see the results. So the program increased my knowledge of nutrition and eating healthy, and about 96% of them felt it did. So you are doing something similar to that, where you're attending some of these programs and learning more. So I think there is a benefit. And the other question, on a 1 to 5, how likely are you to eat more fruits and vegetables? And it seemed like the vast majority felt that they would. So listening to programs and speakers may make a difference. How likely are you to eat less often at fast food restaurants? More people again. And this was done a couple of months after the talks. Here's another one. How likely are you to prepare food at home? Most of the people were more likely to prepare food at home. That was very encouraging. And here's another one. How likely are you to walk on a regular basis? We also talked about exercise, and that seemed to make an impact in their behavior. So just, that to me meant that the things you're doing now by listening to speakers and listening to talks are probably going to help you. I mean, from that survey, I was encouraged to see that people were changing and they were making a difference. It wasn't just something that they just listened to and they walked away. They were actually was having an impact on your lives. And so when I think about healthcare, this is a cartoon I had done. You've probably seen different versions of this. Some of the big chronic illnesses we look in the US are diabetes, heart disease, and obesity. And as we look at it, as it starts filling up the area, it's very hard for the healthcare systems to completely take care of everything, because the numbers keep increasing every year. And so what one has to do is look at the source, which is poor nutrition, sedentary lifestyle, and stress. And changes are going to need to be made there to make really effective long-term changes. Because to me, at this point, it's about improving people's lives, and I think it's really important that people that you have the tools to improve your lives, because a lot of that power is in your hands. It's something that you can completely do. This is a farmer's market, which is one way to think about it is as a new pharmacy. Think about the farmer's market as the pharmacy of the future. And this is where you get your fruits and vegetables, all the phytochemicals, nutrients, and everything you need. And actually, there are some healthcare organizations that do sell that in their pharmacy. They have fruits and vegetables. And so you ultimately have to decide where you want to be. That small changes will catch up over time, and then to design your environment to work with you. So this, I like to show this because it's the example. This is a tree which is growing so well. It's on the coast of Monterey. I was walking there this last year and I saw this. It made me think about lifestyle, whether it's nutrition, exercise. It's the roots. When the roots are strong, when your lifestyle with your nutrition is very strong, then the rest of your body, the tree, grows really well. And that to me is a great analogy. Here's a picture I took when I was in Yosemite last year. It was actually a picture with my phone. You can't take a bad picture when you're in a beautiful place in nature. And it made me think of, this is a quote from Albert Einstein, nothing will benefit human health and increase chances for survival of life on Earth as much as the evolution to a vegetarian diet. I think he was pretty prescient. He was correct with that. Here's actually, this is my son. This is several years ago. We were on vacation and he was trying to write thank you on the sand before the waves washed it away. And there were several tries and he got it. And so he wanted me to show this to all of you. So, I want to thank you for taking your valuable time to be a part of this. Thank you so much. And I'm going to stop and I can take some questions. Let me see. I'm going to stop sharing now. Is that right?
Yeah,
And,
stop screen share. Yeah, because a lot of people are saying this is a great guest. This is a great presentation. Boy, I can't believe you were driving under the influence of a heart attack.
Yeah. It is. I should have pulled over to the side. I should have called 911. But when these things grip you at the heat of the moment, my only focus was trying to get to the emergency room. But yeah.
What does a heart attack feel like? And does it feel differently for different people? And I've heard that sometimes it presents differently for women than it does for men.
Yeah, that's a good question. So there are a variety of ways you can experience it. Sometimes it could just be some shortness of breath, or other times it could be chest pressure. You could feel pressure on your chest. The classic is an elephant sitting on your chest, where you feel this pressure pushing on your chest. Some folks feel left arm pain, but women may feel it differently. I mean, they may have some indigestion. They may have very minimal symptoms, and I think there's a recognition in general in the medical establishment that we don't recognize it as frequently in women as we should, because it presents a little bit differently. But the classic symptoms are chest pain, shortness of breath, and maybe some left arm pain. Yeah.
The statistic you gave earlier was alarming, that every 34 seconds somebody has a heart attack and every 60 seconds someone dies of heart disease. That means since we started this program, almost 40 people have died from a preventable disease.
Yes, exactly. And when we think about it, there's a picture I usually show, but I didn't have it here. It's a picture of a lot of folks lying in a bed in a huge auditorium because there was a shortage of hospital beds, and that was taken in 1918 during the 1918 flu, and where there were a lot of deaths. I mean, it's ironic that but that was the only time that it had exceeded the number of deaths of heart disease. But heart disease since then has been the number one killer. And if you look back 100 years ago, the number one killer was mostly infectious disease. That's what's happening, and that sort of switched. Something happened in the last couple of decades that has increased our burden of chronic illness, and whether it's heart disease and diabetes, and then when you look at diabetes and pre-diabetes, the numbers are growing so fast. In the next couple of decades, they're going to be astronomical.
It's incredible that you can stent within a stent, and you can do it 7 times. What happens on the 8th time?
Yeah. Yes. So, that was to me, that was interesting because, I didn't realize that could be done. And so when my father had that stent put within this, and this is very technically sophisticated cardiologist, he was one of the best. And so not everyone can do some of these procedures. And so when he put the stent within a stent, But what happens with the stent is that scar tissue starts developing and then plaque starts forming. And so then you're putting in something else and then you're dilating it again. And there's only so much you can do, and one thing that is important for people to realize that these procedures, stents and all that, they don't reverse disease, and some of the studies show that they don't reduce mortality, in the acute setting, they're very important. You absolutely need them. But when you think about it, long term, it's not that, okay, I put it in and I can walk away and I'm cured. That's not the case, because it's more of a systemic issue. Because if it's affecting one vessel, more than likely it's affecting other vessels, and maybe not just the heart, maybe other parts of your body, brain as well. And so you need to target it from a more systemic way. And that whole process is, nutrition is a powerful, powerful part of that. And there's a huge understanding when I look at the literature. There's more and more being published on that almost every week. And the American Heart Association has now come out and said that you should be eating plant-based foods. So as the American Cancer Society, and so there's more of a recognition of that.
Yeah, that's unbelievable. Your children were very young when this happened. Did you end up changing their diet as well?
Yeah, that's a very good question. Now, it's pretty challenging with children and kids, and many of you probably have kids that you're trying to get to change to diet. So my kids they're actually teenagers now, and so it was a challenge because the foods you get in schools, pizza, hot dogs, there's a lot of fast food and unhealthy food, and I think they provide it because people demand it. Your parents demand it, and they feel they wouldn't be able to sell that if they didn't have it. And so, they're getting these foods when they go in, and then we're having to try to change them when they come back. And that was hard because, we had to make some transitions then by saying, okay, let's look at options. There are these tofu sausages. There are some, what we call them intermediate foods. There are some foods that are sort of halfway. And so they were okay with some of that. And then my teenager, we gave him sort of a deadline. When you hit 15, then you need to fully transition. I think it's important. You might have some genetics too. And I think he agreed with that because he had a more running start. But then seeing us do it was very good. And then we prepare that at home. And then we also involve them in some of the cooking. They come and help make it. For example, vegetarian pizza, they can help make the dough and put it all together. And kids are more likely to eat food that they prepare, and then try to make it colorful, put lots of color on it. And I think it's still a challenge, I'll be the first to admit, but we have to try. And so they're on that pathway. They're not 100%, I'll be honest, but we're working towards that. Yeah.
Well, you mentioned genetics. How important is genetics to this? Because you weren't grossly overweight, and I think you even said you exercised, and I don't think you had the most horrible diet.
Yeah. It's true. Genetics definitely plays a role here, and now there's so many. The field of genetics is actually skyrocketing. You have all these companies that you can actually submit a sputum sample, and they'll run your genes for you, and and they'll try to see if you have risk factors for heart disease and everything else. And as we map the human genome, we're finding more and more things. But I think, to me, me personally, I think in some ways we might be going down, a rabbit hole, because genetics plays a role in that. Yep, you can identify someone who's at risk, but it doesn't necessarily mean that that gene is going to activate, right? If you have a gene, you could spend your entire life having a gene for Alzheimer's or cancer, and it could never activate and never be an issue. Question is, what turns it on? Because these genes have switches that turn them on and off. And there's this whole field of epigenetics. And I think, in the next few decades, I'm excited to see what else is learned. So clearly, environment plays a huge role in pulling that trigger. And so although genetics may play a role in some areas, there is no question that it is not the whole picture. Even if you have genes that say that you're at risk, doesn't mean you're doomed. The environment and lifestyle plays a huge role in that. And so I think our focus needs to also be in those environmental factors, and the studies need to be focused on that to see how that changes. I mean, we see some countries where they're high risk of Alzheimer's and get genetics, but very few of them have it. And so there's something they're doing that's not causing it to trigger it. And I think genetics is not the whole story. I think lifestyle, and that's very encouraging. Lifestyle is powerful.
Well, thank you for saying that. And genetics loads the gun, but diet and lifestyle pull the trigger, as they have said many times. Terrific. Do you think that if statins hadn't been invented, we'd be better off because then people would be forced to make dietary and lifestyle changes?
Yeah, that's an interesting question. I mean, I think, there's definitely some value to it. I think, when we look at the trials, but I think, what is happening to many ways is that, it's easy not to change your lifestyle and assume you can eat your steak and then take your statin, chase it down with a statin, and then you're fine. And I think that's where the danger comes in. I think it's assuming that it is the magic bullet. And so, and besides, it affects one piece of the pathway, right? One piece of the pathway. We know that heart disease is much more complex. And I'll tell you my personal thoughts, I've seen patients with fewer risk factors who have heart attacks. And so there's obviously more to it than we know. We know the risk factors that cause it, but we also know that inflammation triggers that. And there's so many other things that cause inflammation. And so the medications, whether it's statin or anything else, they affect one path of the pathway, but clearly the nutrition is powerful because it's doing something at the beginning, right at the beginning. And that may be turning off a cascade of maybe 1,000 different pathways that we don't know of yet. And maybe we have yet to find them out. And the decades ahead, maybe 50 years from now, we'll find out. But to me, I didn't feel like I had the time for that. I feel we need a solution now. We need to figure out how to reduce that. And then another exciting thing that has come out is the microbiome. And some of you may be familiar with that. It refers to the bacteria that grows in our colon. We have more bacteria growing in our colon than we have human cells. So we have more bacteria than cells, and not just colon, but skin and everywhere. And so they play an immensely powerful role in our health. And this data has only been coming out the last 2 decades. And when we eat certain foods, it changes the bacteria in our gut. So a vegetarian has a different fingerprint of bacteria than a meat eater. And this bacteria, based on what it is, can be harmful or can be beneficial. And we know that fiber in your diet promotes the beneficial bacteria. It produces what's called short chain fatty acids that actually help protect that layer and reduce chances of inflammation. And so there's signaling that occurs with the brain and some of the chemicals they produce. So it's really early on. We're learning more about this and more to follow. And I'm excited in the next 2 decades, more to follow. But it goes back to the same thing, doing the right thing, eating the right way will trigger all these changes that we have yet to find out about.
Great. When you mentioned genetics, a couple people asked if you have the a high LPA
Yeah,
gene or a certain
sure.
APOE gene. Do you need to do anything different when you have these genetic markers, or we should just all be on the low fat, whole food, plant-based diet?
Sure. Yeah. So I personally don't have the LPA. I look for that, but but if you do have that, sure, that could be high risk. But I just read a research trial that came out, I think it was 2 months ago, that showed that a plant-based diet reduced LPA. It actually reduced the LPA and inflammatory markers in that particular trial. And so there is hope. I mean, there's no drug I know that reduces it, but this plant-based lifestyle seemed to work in that particular trial. So more to follow, I think, and there will be more genes to come. And I think the idea is not to chase the genes, but to change the foundation, and definitely follow your doctor's advice, but at the same time change the foundation, because we will discover these in the next couple of decades, and that will take time.
Yeah. So Ruth is saying, should we take a baby aspirin every day to prevent heart attacks? Aspirin doesn't prevent a heart attack. It's what you put in your mouth.
Well, so that's become more controversial right now because there's a risk of bleeding with aspirin. And so there is a risk score that's calculated based on your age, your cholesterol level. There's actually a formula, and you could probably find it online, aspirin risk factor. You could type something like that, equation, but I would recommend talking to your doctor. I mean, I would defer you to your doctor because they're very skilled at determining that risk. I wouldn't take an aspirin unless your doctor advised you to take it. I mean, there was point in time a few decades ago, everyone was taking aspirin. You're saying, oh yeah, we should all do it. But it does pose some risks. So definitely talk to your doctor. They can determine your risk and effectively tell you whether it would be, because it's always, everything is a risk benefit ratio. Make no mistake. So you have to balance the risk and benefit, but it's an option. Definitely talk to your doctor about it.
Right. Well, it's not an option for me because I was born allergic to aspirin. So I'm going to stick with the whole food plant-based diet to prevent heart attacks, which many of my families have died from. So this is an interesting question from someone. They said, if you have high blood pressure and high cholesterol, does that mean you have heart disease?
Yeah. So no, I mean, I think having high blood pressure and high cholesterol puts you at risk for it. I mean, I think you would be at risk for that as well as other things, the stroke, and there are other things they'd be aware of. So, but it was definitely something that you need to address. I mean, if you have those conditions, you should be working with your doctor to address it. Definitely using lifestyle as well as medications if you need it, but lifestyle should be a huge part of it. And I'll tell you, I'm humbled by my patients. My patients teach me things almost every day. And, many of them want to make these changes because they feel that they could do it. They could reduce the medications by changing their lifestyle and then just regain their vigor and their vitality. And I think, so you're asking all the right questions, but I would recommend partnership with your doctor in reducing those risk factors.
So Randy's saying you have a calming voice. Do you have any meditation that we can listen to? Because you really do have a very nice voice.
Oh, it's very kind of you. I'm actually also a yoga instructor, believe it or not. While going into this, I started looking at all the beneficial ways. So I'm a 200-hour yoga instructor with Yoga Alliance, and I also practice Tai Chi and mindfulness meditation. And so I recommend actually mindfulness as a meditation process. And there's some great stuff written by John Kabat-Zinn. It's JONKBOTZINN at the University of Massachusetts. He's done a lot of research in this area, very well known, and it's really scientifically proven. And you can Google it. He does some free lectures on YouTube, or he has some books on it if you want to start off. But mindfulness is a very effective practice. I try to practice that daily. It's hard. Sometimes life takes you a different path, but I think, and there's benefit even with that, separate from diet. It's a whole different area. We could talk for that on hours, but
maybe you could come back and talk for that. No, I'm being very serious. Or maybe you could even come back and do a live yoga class. What type of yoga do you teach?
Yeah, so basically, hatha. There's hatha yoga and there's vinyasa. And then I've been looking at something called yin yoga.
That's my favorite. That's what I practice.
That as well. Yeah. And so, there are different variations of it. And so the vinyasa is a very fast moving yoga. It's good for the cardiovascular system. The hatha is a little bit slower. The yin yoga is slower, not as slow as restorative yoga, but you hold these poses for about 4 minutes. And so that can be helpful. To me, our daily lives, when we look at it, we're sitting a lot. We're looking at screens. I know we're doing that now. We're looking at our phones. And so, we're at risk for back injuries and neck injuries. And, sitting, by the way, is the worst thing you can do. It's like smoking. It's bad for the back. And so yoga to me is a way to balance things out. It's slightly different from cardiovascular, but making sure that we stretch and relax. And when we stretch the long muscles in our body, that triggers relaxation by triggering the vagus nerve. And I found, at least for me, it triggers relaxation. And so definitely another option.
Well, I love that you're saying that, because I'm currently hosting a summit based on GI health, and that actually is one of the treatments for certain GI disorders, yoga and mindfulness. So this is amazing. Well, maybe you could.
One of my colleagues actually wrote a book on I think it was irritable bowel disease, where he had done a trial where he had kids, innocent kids, to have them do, I think it was Tai Chi, and he saw some benefit. And so,
may I ask who that is? Because he sounds like he'd be a great guest.
Let me find out and ask him, because I don't want to throw out his name unless he gives me permission.
You don't want to throw him under the bus. I understand. Not everybody.
But,
you're very kind.
But how about I connect you to?
Sure. Sounds terrific.
I'll connect you to him, and and he could be an option. Yeah, he might be delighted to do it.
but I'm very serious. I'm also typing in the chat to the people watching live that I've had a lot of people come on, their yoga teachers, talking about the practice, but now we're going to start having an extra broadcast several days a week where yoga teachers are actually going to be doing, live shows. So that would be amazing. What I really love about you, Dr. Misquitta, is you practice what you preach. And the last time we saw each other was at the Disneyland Hotel for the medical conference where I was doing a cooking demo. And I had made some food, and you ate like me and like Dr. Steve Lawenda, who was there. And so I was going to share my food with you. But one of the recipes, for whatever reason, I made an overnight oats. I don't usually use coconut milk, by the way. I usually use almond milk or something like that. But it did have coconut milk in it, and you wouldn't eat it. So you really adhere to the low fat part of this whole food plant-based diet like I do. So can you just end with talking a little bit about that? Because so many doctors today are not only pushing oil is good for heart health, saying that, vegan keto is good, but just insisting that we got to eat nuts or we'll drop dead. And I don't find that to be true. It's been almost 10 years now without added fat, because there's fat in the food, and I'm thriving, and my omega-3s just get higher and higher without nuts, seeds, and avocados. So maybe talk about that is an okay way to eat.
Yeah, I first want to say that, Chef AJ has such a kind heart. And I do remember that day we were at the Disneyland Hotel. I think Dr. Kim Williams, who was also there, and we were on a panel to speak there. And then at lunchtime, I didn't bring any lunch, and I couldn't find a restaurant to offer the food I wanted. And Chef AJ had this amazing meal with her. She comes prepared. And then she offered to share it with me. And to me, that was, thank you. I mean, that was really generous. That was your food. And, I kind of felt bad, but you shared your meal with me. And I have to say, it was delicious. It was incredible. It was plant-based. There's no oil.
It was a salad that it's on my YouTube channel. It had sweet potatoes and a smoky dressing.
You remember?
And oh no, it was delicious.
It was, and I still remember that dish. And so, and going back to your question, so, what is to me, in the last, I've been actually talking about this for over a decade, and, Ornish has been talking about this for a couple of decades, and so has Esselstyn. And, nutrition is a tricky area. If you look at nutrition education in medical schools, there's really not a whole lot of it there. And so, so we need more information in nutrition. And I think, to me, doctors are very noble folks. They truly want to do what's best for their patients. But the field of medicine is evolving at such a rapid pace. I mean, there's so much information coming out now that maybe it's not as important to know, but know where to go and reach to find it, because it's incredible. The volume that is there now is even higher than was there 30 years ago. And nutrition information evolves at that rapid pace as well. And as we're finding more about it, I think, as physicians learn more about it, they're starting to advise it. I know my colleagues are starting to shift towards it. And I'm seeing more continuing medical education lectures that I put out there. These are lectures that physicians attend that have nutrition lectures. I've put some on myself, and a lot of interest, many more people coming. And so I think as we start moving forward, we're going to see more physicians that understand it. Clearly, there'll be some that are not aware of it, but there's also a field called lifestyle medicine that's coming out. And all that means is that physician is doing some extra training in this area to learn more about lifestyle changes like nutrition, essentially plant-based nutrition, exercise, stress reduction, to help reverse disease in addition to their current field of practice. And so I got certified in that a couple of years ago, and now more and more people are getting certified in that. There's a body called the American College of Lifestyle Medicine that's out there educating physicians on all of this. So I feel really good that this will continue to increase, and we're going to see more physicians who are sort of recommending this. And I think it's just that there's so much out there, hard to keep up with it, not enough training in medical school, and so that as we get the American College of Lifestyle Medicine come up and more nutrition information, and maybe many of you going to your doctors and saying, "Can you tell me more about this?" Your doctors, I truly believe, are noble, and they will try to do what's best for you, and they will rise to that opportunity.
That's terrific. So last question, Dr. Misquitta, because I know you have an appointment because you are a real doctor. Can someone become your patient, or do you ever do telehealth, or are you kind of, your practice is closed right
Uh,
now?
yeah, not at this point in time. I work for a large organization in Sacramento, and so it's a managed care organization, and I spend some of my time doing research. There are two clinical trials I'm involved in, and then there are patients that I see. So, I would say I don't do any telehealth, and so it just work within that organization.
Well, we look forward to the day when you don't, because you seem like an amazing doctor, and I'd love to have you back as a yoga teacher. Seriously, because I thought it would be so fun.
Great. Well, thank you so much. I want to thank you all for taking the time to listen to this. I know it's valuable. Time is very valuable. And it's my hope that it has made a difference. And if it even impacts one of you, I feel that my job's done.
Right.
So thank you also. And thank you, Chef AJ. I mean, you are inspirational,
Oh my
as
God.
always.
Well,
Thank
thank
you
you.
so
Is it
much.
okay if I mention who the guest is next week? Am I allowed to say that? Because
Yeah,
you
yeah,
know,
please,
okay,
please.
good.
Yeah, yeah,
All right.
yeah.
I just want to be sure. So Dr. Mosquito's wife, Kathy, is going to be a cooking demo next week. And there have been already requests for Indian food, if she wouldn't mind.
Yeah, yeah, she'll probably tell you more about me. Yeah. And by the way, she's wonderful. She is an amazing chef. And so I learn from her all the time. And I'm sure you're going to learn a whole
Well,
lot. So
well, I can
thank you.
tell, I don't know if you can see the chat, Dr. Mosquito, but all the comments for you are just what a lovely man. They just really loved your voice. They loved you. They loved your story. So thank you so much for sharing. I really appreciate it.
Thank you. I can't see the chat, but if you can share that with me sometime, that'd be great. Thank you so much.
I would
Thank
be
you,
happy
everyone.
to. And guys, thank you for watching another episode of Chef AJ Live. Please come back in 2 hours when we are actually going to have a cooking demo from Nick DeVoren of Local Spicery. Take care, Dr. Mosquito.
Take care,
Bye-bye.
and everyone.